Hello and good day, everyone. I'm Dr. Arun Thomas and our team from Dr. K.M. Cherian Institute of Medical Sciences would be happy to guide you through your next session. I'm sure you're having a good time learning and interacting over the past few weeks, basic and fundamental concepts which we use in neonatal care. And in keeping in line with these basic core concepts of neonatal care, we will go on to discuss thermoregulation in these newborns. You probably already understand that it is a very important concept to know because thermoregulation has already been discussed in bits and pieces in the previous modules, like in neonatal resuscitation. So what we have done is we have tried to break it down into small sessions between 10 to 15 minutes for you so that it's easier to understand. Dr. Aparna will take you through the basics, and then Dr. Ronnie will discuss the practical aspects like measurement of temperature, etc. And then further, what you've learned from these two modules, we'll discuss how we can apply this in our day-to-day neonatal practice. So in module 1, Dr. Aparna will discuss the physiology and why these neonates are especially vulnerable. And in module 2, Dr. Ronnie will discuss the monitoring and management. And then in module 3, we'll bring it all together and we'll see how we can apply these things we have learned in module 1 and 2 in our day-to-day neonatal practice, like in preterm care, neonatal transport, etc. So hopefully that should round up your neonatal thermoregulation for you. So I'll hand over the further session to Dr. Aparna.
Hello everyone, I'm Dr. Aparna. Let us start with the first module for the day, which is Basics of Thermoregulation in Neonates. So what is thermoregulation? Thermoregulation is the ability of the baby to maintain the balance between heat production and heat loss in order to sustain the body temperature within a normal range, which is for the baby, the normal body temperature is 36.5 to 37.5 degrees Celsius. So there is a subtle balance between the mechanisms of heat production and mechanisms of heat loss so as to ensure an optimal body temperature. It is to be noted that baby once within the womb, it is in a warm, cozy environment which is at around 37 degrees Celsius in the mother's womb. So once the delivery process happens, ex utero environment, the temperature range varies between 26 to 28 degrees Celsius. So there is a drastic drop in the temperatures, 37 degrees Celsius to 27 degrees Celsius, and baby has to adapt quickly also. So there is every chance that the baby is prone for hypothermia. So that is why we need to know how these things work in the newborn. So as caregivers, we can help the baby in smooth transition to ex utero environment. So as I already said, the normal range of body temperature for a newborn is between 36.5 degrees Celsius to 37.5 degrees Celsius. Anything below 36.5 degrees Celsius is hypothermia, and anything above 37.5 degrees Celsius is hyperthermia. Hypothermia, the severity level is again classified into three forms. Mild hypothermia is between 36 to 36.5 degrees Celsius, otherwise known as cold stress. 32 to 36 degrees Celsius is called as moderate hypothermia, and any temperature less than 32 degrees Celsius is called as severe hypothermia. More than 37.5 degrees Celsius is termed as hyperthermia, and more than 40 degrees Celsius is termed as severe hyperthermia, and more than 40 degrees Celsius severe hyperthermia is associated with very poor neurodevelopmental outcomes, as is severe hypothermia 32 degrees Celsius. So both extremes are really bad for the baby's good health. And you can see that there is something called as TNZ. What is this TNZ? It is a very narrow window between the normal range of body temperature. So TNZ here stands for thermoneutral zone. The concept is very easy. It is nothing but the range of environmental temperatures where the baby can maintain a stable core body temperature with minimal metabolic effort and oxygen consumption. That means the baby need not spend energy to increase or decrease the body temperatures. So the energy can be spent on optimal growth and development. So as caregivers, we are supposed to provide the baby help so as the thermoneutrality is maintained and baby's optimum growth and development is ensured. Thermoneutral zone varies between babies to babies. So it depends upon the baby's maturity, which is the gestational age at birth. It also depends on the postnatal day and it depends on the birth weight of the baby. This is a tabular representation depicting the thermoneutral zone and recommended ambient temperatures based on baby's weight and postnatal day. It is identifiable that smaller babies and younger babies require higher temperatures to maintain a core body temperatures at normal level. So thermoneutral zone is a bit higher range for smaller babies and younger babies. Now we will see what are the mechanisms of heat loss in neonates. There are four mechanisms of heat loss in neonates. Number one is conduction, which is the transfer of heat from one solid object to another solid object which is in direct contact with each other. So when a baby is directly placed on a cold weighing machine or a cold surface which is direct contact with that baby's body, then the baby loses heat towards the cold surface. So that is called as conduction. So it requires direct contact. Conduction you can remember as D for direct contact with the baby. So cold weighing machines, cold cradles, all these things baby will lose heat by conduction. Second one is convection. Convection is the transfer of heat through cool air via air currents. So this is what happens when the baby is placed directly beneath a ceiling fan or when there is cold air blast from air conditioners, especially in operation theaters. So in such conditions, the cool air will result in dissipation of heat in the baby. So convection stands for cool air mechanisms by air currents. So convection is the second method of heat loss. So in order to prevent this particular heat loss, we should not place the baby beneath an air conditioner. Direct air blast should not be there and baby should be staying away from the ceiling fans as well. Third one is evaporation. Evaporation occurs, evaporation it is something that we know from physics itself. It is the heat loss that happens when liquid is converted to vapor. So it usually happens through skin and lungs. So this is the major mechanism of heat loss at birth because we know that the baby is already wet and amniotic fluid evaporates. So when the baby is wet, it can lose up to 200 kilocalories per kg per minute of heat, which is very drastic. So that within 10 to 15 minutes, baby can lose around 2 to 3 degrees Celsius of body heat. So evaporation is the maximum amount of heat loss that is happening when wet amniotic fluid is being covered on the baby's body at the time of birth. So this can be easily prevented by immediately drying the baby as well as by putting the baby in polythene wraps, especially for preterm babies. So that is about evaporation. So this is a major mechanism at birth through transepidermal water loss because of the immaturity of the skin and wet amniotic fluid. Last one is radiation. I already said at the time of birth, evaporation is the major mechanism of heat loss. During the postnatal life, radiation is the major mechanism of heat loss. So what is this radiation? Radiation is the transfer of heat from the baby to colder surfaces which are not in contact with the baby, but the heat gets transferred by means of electromagnetic radiations. So when the baby is being placed near windows or by cold cabinets, the heat from the baby gets transferred to that colder surface even though they may not be directly in contact with each other. So the heat transfer depends upon the proportion of heat difference between the baby and the colder surface. So that's about the four mechanisms of heat loss: conduction, convection, evaporation and radiation. Evaporation is the major mechanism at birth and radiation becomes the major mechanism after birth. And radiation major loss happens through head. That is why because head is having the major body surface area. So that is the importance of ensuring that the baby is being clothed with baby hats. This is a tabular representation of whatever we have already discussed. Evaporation is the major mechanism at birth and radiation is the major mechanism after birth. So conduction and convection stays in between. That's about the mechanisms of heat loss. Now coming to the mechanisms of heat production, the first defense mechanism is altered blood flow. Whenever there is a cold stress, there occurs vasoconstriction and the blood vessels contract. So that is the reason why there will be acrocyanosis and everything noted during hypothermia. So this is the first mechanism. Then comes the major mechanism, which is the non-shivering thermogenesis. We know that the newborn babies cannot shiver. So the major mechanism of heat production in newborns is non-shivering thermogenesis. When it comes to non-shivering thermogenesis, you should remember how it happens is whenever there is a cold stress, hypothalamic nuclei gets activated and there is an increased sympathetic activity, which results in release of norepinephrine in brown adipose tissue and also the release of thyroid stimulating hormone. So brown adipose tissue is a richly innervated specialized fat tissue which is seen in the certain sites, especially over the interscapular region, axilla, back area. It is also seen in the thoracic inlet area, around the aorta, around kidneys and suprarenal glands. So what happens there is norepinephrine there and it is being released and ultimately it stimulates the uncoupling protein 1 in mitochondria. So there is leakage of protons across mitochondria and there is oxidation of fat resulting in heat production. So major mechanism of heat production is non-shivering thermogenesis by means of brown adipose tissue and neurotransmitter involved is norepinephrine. The second mechanism is increased metabolism. Brain, heart and liver produce metabolic energy by oxidative metabolism of glucose, fat and proteins. This is the next mechanism. So during this time baby will move, stare and there will be resulting in cortical consciousness also. So even we will be knowing that the baby is cool and we can adjust the blankets and ensure that the baby is warm also. So that is about the mechanisms of heat loss and mechanisms of heat production. We already said that thermoregulation is a balance between mechanisms of heat loss and mechanisms of heat production. Unfortunately, our delicate newborns are at inherent mishap because you can see that there is a large surface area to body mass ratio which increases the heat loss. And there is immature skin and decreased subcutaneous fat which exposes the baby's body to increased heat loss by evaporation and convection. At the same time, there is poorly developed mechanical metabolism to respond to thermal stress because altered glycogen stores, because they will be having limited glycogen stores and everything. And there is altered skin blood flow. So there is increased amount of heat loss and compensatory mechanisms of heat production is comparatively less as well. So babies are at higher risk of heat loss inherently. And we have said that from 37 degrees Celsius in utero temperature, baby is being delivered to a 26 degrees Celsius ex utero room temperature. So the transition will also be coming faster and hypothermia risk is very high in case of neonates. Preterm babies are even more vulnerable given that they have an immature skin with very minimal layers of stratum corneum. So there is 15 times more permeability. So there will be increased transepidermal water loss happening through their immature skin. And inherently they have an extended posture, which means that the immature skin will be more exposed to the outer surfaces. And there is a 5 to 6-fold high body surface area to weight ratio, which again increases the heat loss. And they have a limited glycogen stores, means that the increasing of metabolism in compensation to heat loss is also very minimal compared to term babies in case of preterm babies. So preterm babies, all newborns are at risk of hypothermia. Preterm babies are even more vulnerable for hypothermia. So why we are bothered about this? It is because hypothermia when untreated can result in serious and devastating consequences. So what happens when a baby is cold? So once there is a cold stress, there is activation of non-shivering thermogenesis and metabolism of brown fat. But if the cold stress factors are continuing, it can result in increased oxygen consumption, pulmonary vasoconstriction resulting in tissue hypoxia, peripheral vasoconstriction, anaerobic metabolism, and metabolic acidosis. Again, there can be increased glucose use resulting in depletion of glycogen stores, ultimately leading to hypoglycemia. So, untreated hypothermia can initiate a vicious cycle of tissue hypoxia, hypoglycemia, anaerobic metabolism, metabolic acidosis, which again makes the baby prone for infections. And this vicious cycle, if not addressed early, can result even in case fatality. That is the reason why we are bothered about hypothermia and prevention at any cost. Statistically, multiple studies has been done to identify the consequences of hypothermia, and this was a recent meta-analysis published in the Journal of Maternal Health, Neonatology and Perinatology, published in 2021. So, as per the meta-analysis, it was found that hypothermia in VLBW babies was significantly associated with mortality, intraventricular hemorrhage, bronchopulmonary dysplasia, neonatal sepsis, and retinopathy of prematurity. So it is an independent risk factor for mortality and morbidity, especially in vulnerable babies. Again, even for the term babies, it was found that admission hypothermia is an independent risk factor for mortality. Though the statistical figures vary, it ranges between, once there is every 1 degree Celsius drop in admission body temperature, the mortality rates was increased. Certain studies told it was 28% and some studies ranged between 80%. So on an average, case fatality rate in India, as per the studies, for even mild hypothermia, it is up to 40%. And for severe hypothermia, it is up to 82%. So hypothermia in naked baby at 23 degrees Celsius will feel exactly like how we will feel when we are naked and frozen at around 0 degrees Celsius. So this is how the baby will feel even at 23 degrees Celsius. And the consequences like frostbite and everything that an adult will feel, same thing the baby will feel when the baby is hypothermic. So coming to the last slide, this is just a quick recap whether we have understood what are the mechanisms of heat loss. So the pictorial representation shows certain steps which are employed in delivery room to ensure that normothermia of the baby is preserved. So number one, we will be keeping the room temperature at 23 to 25 degrees Celsius. What is the method of heat loss that is being addressed by this? Second question, by using a radiant warmer. What is the method of heat loss addressed? Warm bed surface. Use of heated humidified gases for resuscitation. Putting a baby's head cap. Using cling wrap. So these are the methods of prevention of heat loss, and let us know what are the methods of heat loss which are aimed at preventing by employing these methods. Thank you.